Hi, and welcome to another edition of the Ask Dr. Jack show, where I answer the questions that you ask. I'm Dr. Jack Belitz, chiropractor in Omaha, Nebraska, and I'm here to answer some more exciting questions from patients and subscribers. So let's get right into it. This question comes to us from a patient who has a family member who is in serious trouble and needs to undergo chemotherapy. And of course, you know, as much as I would love to say that chiropractic can do the be-all and end-all of everything, sometimes you need to get with conventional medicine, and you have to do the chemotherapy stuff. And so when that is the case, is there anything that can help and maybe support it? Well, I happened to find a great, amazing study. It was done a couple years ago, but what they did was they looked at studies that were done between 1973 and 2011. So a huge, beautiful study. It involved quite a number of people in it. And what they were basically looking at is if vitamin E could be of benefit to people who are taking chemotherapy. Specifically, there is a problem with certain chemotherapy where people start to lose their peripheral, they start losing feeling in their periphery, like their fingers and the toes and things like that. The technical term for it is called CPIN. And it happens when the chemotherapy drugs damage nerves in the arms and legs and cause numbness and pain in fingers, hands, legs, all that stuff. So it's a pretty serious consequence of chemotherapy. Now, granted, you're still alive, but if you're in that much more pain, I mean, sometimes you wonder if it's really worth it. Well, what they did was they looked and they found that if you take between 300 to 600 milligrams of vitamin E a day, then you are 57% less likely to undergo these types of problems. There is one particular drug that is really known for this, and that particular drug is called cisplatin. They looked at that study, and you were 74% less likely to run into problems. Now, what are the side effects? What are the possible consequences of vitamin E? According to the study, absolutely nothing. So what do you got to lose? Anyway, if you know of anybody, any loved one, again, I'm not here to give you medical advice. I'm just here to pass on information so that you can make an intelligent decision for yourself. So if you or a loved one's undergoing chemotherapy or has to, ask your doctor about vitamin E if there could be any problem with it. And if not, what do you got to lose? About 400 milligrams of, 400 IU of vitamin E is equal to 600 milligrams. And vitamin E is usually an IU, so go the 400 IUs. It's not really that much. It's like usually about one pill, depending on how big the pill is. So anyway, I was really excited about this. I wanted you to have some understanding about it. And this is Dr. Jack Belitz giving you the information I can. If you have a question that you would like to have answered, you can go to askdrjackb, that's B-E-E, at gmail.com. You can come into the office. You can call the office at 402-333-4848. I'm here to take any kind of question. I'll do the research. We'll find out what we can for you. Have a beautiful and healthy day.